The broadcast is now starting. All attendees are in listen-only mode.
All right. I think I started the webinar, Rich. How you doing, buddy?
Doing well, thank you. Yeah, a couple weeks ago, Guy and I did this, and we were talking for 5 minutes, and we'd forgotten to push the start button. So you're way ahead of the curve already, Guy. So good job.
Absolutely. Well, thank you, everyone, for joining us on this very important tax day. I hope everybody got their checks off to Uncle Sam. We already see a question coming in. Maybe if you've got questions, we've got everybody muted because we have in the hundreds of people signed up for this thing tonight. We'll get to all your questions before the night's over. Just type them in and we'll get to them. But, I think as we were putting this together, Rich and I were talking about, we're talking about team here and how we succeed in dental sleep. And Rich and I were talking about what is the number one reason for people, dental offices, they want to do this. They see the value. They know that their patients need this. They know they can help save and extend lives, improve their patients' livelihood, make money, all the things, but they don't succeed. And Rich, we gave it a lot of thought, and what did we decide?
We should tell everybody to type something in the question box.
Yeah, type it in the question box. See what we
survey.
Yeah, see if it's anybody's typing anything in about what the.
And what we're asking really is why do we not succeed more at dental sleep? When we do this, what do you think the biggest obstacle or hurdle to that is? So
I'm not seeing anything.
I don't know, Guy, it's killing me, man. What did you come up with?
Well, I hate to tell you, but what I really believe is the dentists themselves get in their own way. We're so used to doing things like dentists where we have to do everything, where dental billing, everything that's done in that dental office has to be touched by the dentist, and it's totally different in dental sleep. And I think if we can just kind of clear our minds and think about dental sleep medicine as a totally different adventure, it has a little bit to do with dentistry, but it's a lot different. And we can get out of our own ways. We can succeed. You have to have a game plan, though. This is just really planning. It's not technical like dentistry. And when you have a game plan, things turn out well. When you let Rich design your home and he's not an architect, and you don't think about things, maybe you end up with something that looks like this where we weren't thinking.
Yeah, I think part of it too, Guy, is maybe it's where you are in this dental sleep medicine journey too. We try to make these things applicable to both beginners and people who've been doing this for a little while. So, when we asked that question, some of you said, "Well, medical billing, that's the hardest." Well, you're not in the way anymore. You're a little bit further down the line, but we're kind of starting at the beginning, and we're trying to kind of walk people through how they do this. And I promise you, regardless of who you are, how long you've been doing this, I think you're going to get something out of this.
Yeah, and having a plan is important. I think today we're going to talk about involving the team and what the team means, and we'll expand on that, because the team's more than just the team in your office. That's one of the challenges of dental sleep. It's not just your one or two assistants or front desk people, administrative people. We have to have a team to do this, and we need to have roles for each of these, the goals for those team members. They have to know what their job is, and then if things aren't going the way we want, and for some reason someone else needs to pick up the ball and run with it, we need to be able to revise that. And as we have here on the slide, pivot. We need to be able to change our game plan, because I tell you, dental sleep's changing too. And as we modify what we're doing based on how the temperament of the medical community is, the patient's attitudes, insurance, sleep testing, all these things are always changing. So we've got to have a roadmap for success. And I think we'd like to stop for a moment and say, some of you have been doing dental sleep for a while. A lot of you are kind of new to this. Some of you have been dabbling, and we want to ask, why are you doing this? And if we start have a meeting with our team and we sit down and say, do we want to get involved in dental sleep? Let's really sit down and think about why. Why are we doing it? Are we doing it for what reasons? And then if we decide we have a purpose and a mission, and we're doing this for whatever reason we decide, and we have a process that we can define and agree upon with our teams, the result is that we'll get something really wonderful out of this, and it will reinforce the why as opposed to going the other way around. I know, Rich, I think you're the first one that showed me this as far as this way of thinking. Anything that I missed on that?
No, I think that's good. I think as dentists, Guy, we typically do this backwards. We just look at what do we need? Well, that tooth's broken. We need to fix it.
Right.
I think that's probably inherent in how we are taught as dentists, in a lot of ways. So I think we want to get you to take a step back and kind of look at the big picture first. We're trying to map out a plan to help you guys succeed, and we look at this and we do that. So, when we think about why, Guy, I know I read something the other day said 10,000 people in the United States turn 65 every single day now.
Wow.
So we are an aging population. Well, a certain percentage of that are dentists. So we know that a lot of our DS3 members that we'll talk a little bit about tonight, but we know a lot of our DS3 members are, they're tired of bending over and drilling on teeth all day, so they want to transition out of that. So, I had somebody there the other day, Guy, at the office, and it's killed my husband. He died in his sleep of a heart attack, and he had sleep apnea, and he wasn't wearing his CPAP. So you got to figure what that is out for you. And I know that. And your team. Yeah.
But together we have a meeting. We talk. Do we want to do this? And so, what are we going to get out of it? Why do we want to do this? What's our motivation? And if we agree upon that and how we're going to do it, once it's accomplished, you're not going to really accomplish. Once you start going down that path, you're going to continue to grow. You'll get some real positive rewards. Without belaboring this too much, there's a lot of good reasons on the screen here. But I can tell you one real story for me personally. When I first started doing this, I met the fire chief in town, the Manatee County here where I live, in shape guy. Someone introduced me to him at the gym, and I'd see him passing. Hey, Doc. I'd say, hey, Chief, and how you been doing? That kind of small chit chat. And then one day he asked me, hey, I've got apnea and I can't wear my CPAP, and I know that I've heard that you help people that can't wear their CPAP. Can I come in to see you? And I said, sure, I'll be happy to. And the next time I saw him, I gave him a card, which just a few days later. And then I was shocked when I saw his name in the paper within a week of me giving him the business card. And right there in the paper, talked about him having apnea and that they felt led to his death. And even though he was in shape and won body, entered athletic competitions and so forth. And boy, that really made me step back. And this has been quite a few years ago, well over 10 years ago. And it really made me feel like, the medical community kind of failed this guy. And here he has an 11-year-old kid that won't have his dad. And some of you have heard this story before, but it's still, every time I tell it, it makes me realize this is worthwhile being involved in dental sleep. I know, Rich, you have your own stories about why you're involved.
Yeah, and I'll tell a little bit of those as we go along, Guy. But, I will tell you that in my lab, we have incoming cases and we have patients that are scheduled. So we got, at any given day, we're delivering I do a lot of this in my practice. We do it all day, every day. And there are 2 cases on the one side, Guy, and the patients died between the time we took their scans and before we could give their dental device to them. And I won't let my staff take those out of the closet. And about once a month, I walk everybody in there and I say, this is why we do what we do. Right there. And you cannot create enough sense of urgency in both ourselves and our patients and our team. That's what we're talking about.
Right. So I think if we're going to do dental sleep and we're going to involve the team, we just can't stand up on a pedestal. I think is what we're saying, and saying, you're going to do this. It's a mandate. Hopefully you'll involve your team in this decision. Hopefully you'll involve them in deciding on who's going to do what as we go through this, and starting in just a second. And if you'll involve them, I promise you the payoffs will be greater. The service to your patients will be greater. Their enjoyment and coming to work will be greater. So a little housekeeping. You will get a CE certificate if you are on here this evening through the hour. It's an hour long. And you'll get it within the next 72 hours. If you can't find it, look in your spam folder. Rich and I have been doing this for a long time. Over 30 years between us, thousands of devices we've delivered. Rich and I both see patients. Rich sees, that's all he does. I help manage our business where we come to work every day just to help you and your offices succeed in dental sleep. We'll talk more about how we can help you towards the end of the presentation today. But if you have any questions, by the way, that we're going to try to get to all of them. If you want to spend more time or get more in detail or just want to know how we can help you more, type in consult anytime throughout tonight, and we'll set up some time just to help you with your challenges and answer your questions and talk about how we can further get you down the dental sleep path. Next webinar, this is going to be I'm confident there'll be probably almost a sellout. We can usually register about 500 people. This is always a very important subject. So in a couple of weeks on May 1st, we'll be talking about medical billing. So don't forget to put that down in your calendars.
That'll be a popular one, Guy. Next time, everybody likes medical billing. That's probably one of our most. A couple of people mentioned that, Guy, when we asked why people don't do that. They said, well, it's hard to get paid. So, we got a couple of tips and tricks. So we look forward to sharing that with you next time. So you got a lot of people on your team, Guy. It takes a lot of people to make this happen successfully in a practice, doesn't it? It's not just the dentist.
Not just the dentist, not just the assistant, not even just the hygienist. So we're going to talk about how we involve our team members, both the ones that we employ in our office, but we also need team members that are outside of our office to be successful with this. And dental sleep medicine has just a lot of moving parts. We'll touch on a few of them today, and nothing's really complicated about these cogs here, turning these wheels or a chain. But if one of those cogs are missing or a chain's broken and you don't have a system and team members who are responsible for each of these steps, you won't make it. So we'll start by talking within your office. I think a lot of you probably felt this is what we'd be speaking about tonight. Your team. I think we're, as dentists, back to our original slide, we think like dentists, and we do everything ourselves in our dental office. So we're going to talk about the external team in a bit, but certainly you have to have an internal team members to do this.
Yeah, and from a high level, I think most dental offices have front office people, administrative, and they're already working hard. We don't want to overload, too many of these people too much. And, you certainly have your clinical staff in the back. You have hygienists. And we'll get into a little bit more about what we want these people to their role to be. When we think about hygienists, Guy, the first thing I think of is screening. The DS3 has a little tablet screener that you can do, and that's certainly a way that we can involve hygienists.
Yeah, and our assistants, certainly you've got impressions to take and devices to deliver and follow-up care, rooms to be ready. And these are the team members, I think, that we're all used to utilizing. And the question is, what do each of these team members do? And we're going to go into the clinical and the administrative duties in just a few moments. But I think we can pause for just a moment and realize, the dentists don't have to do all this. I think this is one key difference between most dental procedures and dental sleep. I'd say they don't have to. Certainly, if you want to do this and you're independently wealthy or retired and you just want to do all these procedures yourself, then go ahead. But from a profitability, flow of patients, Rich is seeing 50 cases a month or more, it's almost impossible to do that by yourself. And so I think you got to think a little bit, not like a dentist, back to our original slide, that, you don't have to do everything. Most of what needs to be done in dental sleep in most states, including the whatever their legal laws are, most of it's talking to patients, and it's writing letters, it's communicating out with labs and things. So most of these things don't have to be done by you, Mr. and Mrs. or Dr. and Mrs. Dr. Dentist. You can delegate this, and I tell you, you'll be happier, your patients will be happier, you'll be more profitable, and you'll be more efficient at doing this. So this doesn't have to interrupt your practice to a large extent after you get your systems in place. But
Guy, it can unless you have this person. And yes, that's why we talk about this person.
Yeah, and so you can piece this out. You can do things that dentist assistants can do things, hygienists can do things, but then they're trying to do all these different things. And you've heard the jack of all trades, I think is where I found the slide was the purpose for this. And I want to be clear, there are offices who are successful in dental sleep who do take all the tasks. We're going to go into it next in just a few moments, and assign some to the hygienist, some to the assistant, some to the administrative. It's possible. It's a lot more complicated, and the odds of success are far less than if you designate someone in your office to be the sleep, we call the sleep ambassador, dental sleep guru, whatever title you want to give that individual. But if they can own most of these responsibilities, and that's what they do most of the time, and they're tasked with the growing this part of your practice, I have yet to see an office that's made that commitment and hired these one of these individuals, or repurposed an existing team member to this is now your job, to not be successful. I think I said a double negative again, but typically these offices just explode when they make the commitment to doing that.
Let me emphasize the last bullet point you have there on this slide, Guy. Thank you again for putting this together. You and Jason did a great job with this PowerPoint. But this person does not have to have dental experience.
Right.
I think more than anything, Guy, it's organized and articulate. You know, it's somebody that's confident. Somebody asks them a question, they give them an answer. And I have heard stories from some of our DS3 members where they found this person in a restaurant eating dinner, and the waitress was just phenomenal. And next thing you know, they hired him, and that's their sleep ambassador, and they're just, knocking it out of the park with that kind of person. So keep an open mind as you think about this as well. And
that opens up the people that you can hire for this. So if you're having trouble getting team members because of constraints on human resource and where you live, now you have a whole new pool. Yeah, a good example. That's one of my good friends, Dr. Reynolds. His sleep ambassador was working at a car wash, and she's doing a phenomenal job in expanding his practice now. You just have to find the right person. Here on the screen, we don't have to read them to you, but you just need someone who meets these criteria, and you can educate them for the rest. As a matter of fact, we can help educate them too if that's what you want. And it can't be one of your assistants and say that they're going to do all the things they're already doing, and now you're going to do this too. That's what won't work. If they have some spare time and you want to piece it out, it might work. But we're not going to tell you there's no time involved in this, but there's not a lot of dentist time if you find someone. And the small investment in this person can pay off immensely in basically building a whole practice within your practice. And that's exactly what I did in my practice over 12, 15 years ago. I was piddling around with dental sleep and wasn't going where I needed. Rich and I were talking and trying to find systems to be productive. And Rich is going and I are talking. And he goes, "Guy, you can't. Your team members are already busy. You've got a busy restorative practice. How are they going to do all this?" And I hired someone to just own this, and within a matter of less than a year, and that was without the systems that are readily available that we can help you with, it just took off and got a whole meaning of its own, and grew up basically a practice within my practice.
And I know in Texas, Guy, I'm in South Texas here, Central Texas and San Antonio, and for $20 an hour, I can hire a pretty dang good employee. I really can. And that's 1.5 dental sleep devices a month. Mm-hmm. And if you hire the right person and you train them and you get them to where they can do all of these things, there's no way they're not going to add more than one a week of these patients to you. It's probably the single best investment you can make.
Yeah, and I hope none of my team members are listening, because they're going to want to move to Texas, because
no, I said you could get a really good one for that. I didn't think it started.
I think you can find people for less than that. And of course, we want to reward them as they become more and more involved in this. And you can take someone who knows nothing about this, with our help in particular, in 3 months' time, they can be highly productive. So what are they going to do? Again, I'm not going to read the slide here to you. They're just basically going to own all the aspects of dental sleep that you and they feel comfortable. Maybe at first just a little bit, and as they grow, they take on more. But it's nice to know in the office that when a patient screens high for apnea and they need to get a sleep test, you know who to go to. When a patient calls and says, "I'd like to come in to because I can't wear my CPAP. I know you guys, your office takes care of this. Who you go to? The person that needs to get the sleep test, who you go to. So again, I think we beat that up. It will ensure your success. We can happy to field more questions on that after the webinar is over tonight or during one of our consultations. But I think we'll try to break down what those duties are now, whether it's the sleep ambassador doing it or you're going to have various people in your office doing these things. And we're breaking these down to administrative and clinical for you for the time being, and then we have some external team members that we have to have. I would say, Rich, we don't have everything listed here, so we'll just kind of talk about what this person does or what the administrative duties are. I would say far and away the administrative duties are greater in many ways than the clinical. It's more time consuming and
well, they're certainly more important in some aspects. You know, we're as dentists, we're always worried about, you know, is the margin fit? Is this right? Is that right? And you got to remember, Guy, there'll be 100 questions asked. If you're a dentist sitting there listening to this, remember tomorrow there will be 100 questions asked in your dental office. And you know how many will be asked to you personally? About 5.
Yeah.
The other 95 will be asked to a staff member. So you have to train your staff. You have to do this. You know, if you have a sleep ambassador, they're not going to answer the phone every single time the phone rings because we don't know if that's a sleep patient. But if your front office staff is answering the phone, they go, you know, I heard that Dr. Yatros, he made one of my best friends a sleep device and he just loves that thing. Do you think he could see me as a patient? Well, yeah, let me let you talk to Kim, our sleep ambassador, and she'll get this whole process started for you. You know, so you just hand them off at that point. You got to figure out how this works in your office. But I like what you're saying, Guy, because you're saying, what I'm hearing you say is, this doesn't just happen.
Right.
You have to have a plan. You know, you have to think through this, and you already have these front office people that are doing a pretty good breadth of all of this stuff. And then you kind of, when you get going a little bit, you get your sleep ambassador involved in this, then they take over some of this stuff. Now the sleep ambassador is going to go in and do the financial arrangement. You know, we're going to talk about insurance and all these other things, but you got to have a plan.
Yeah, and administrative duties, I think I heard you say it, I was about ready to say it before you did, it's arguably more important than anything else. I mean, the clinical is important, but if we don't get the administrative part handled, we'll not go anywhere. We won't have any patients to see. We won't have, if we don't treat the ones correctly to start with the financial arrangements and letters to physicians and scheduling and follow-up sleep tests and managing insurance and payments and all the things that they have to do, we'll very quickly not have any patients. So if we ever have any at all. So the administrative duties, we can't underestimate them. They're more important in many ways than what we're going to do clinically. And again, we have a lot of things listed here. There's many more that this administrative person can do. Now, we also have clinical duties. And clinical duties, a lot of them, again, a sleep ambassador can do both of these. You don't have to have a clinical and an administrative sleep ambassador in many cases, as I certainly didn't when I started doing this. But clinically, we have to do sleep testing. We've got to educate the patient. That's probably the number one thing they do in the, when they bring the patient back, is not anything to do with sticking their hands in a patient's mouth. It's with talking to them about what their sleep concerns are, reviewing results of sleep tests, what they chief complaints, why they want to treat their apnea, what the expected results are, what we expect to deliver with them, follow-up medical documentation and progress notes, letters to physicians, coordinating lab cases, coordinating which devices we're going to use, physician communication. Again, you can see how there's kind of an overlap between administrative and clinical, but if you just asked someone who was sitting in the front and wasn't in the clinic or wasn't in the chair with that patient, they wouldn't know how to say that, hey, Dr. Smith, I know the patient has an AHI of 75, but for this reason, we think they're a good candidate for a dental device. They had to be in the room to gather that from the conversation you and the patient, you as the dentist and the patient probably had. So there's a lot of clinical things, and of course, impressions, bite registration material, being ready, taking bites, adjusting the devices, teaching the patients on educating the patients on how they titrate the devices and recapture the jaw. So there's a lot of duty. So as we were putting this together, we say getting your team together, it really was obvious to me we got to talk about what they're going to be doing, because what I've learned after managing people for hundreds of people now with the DS3, it's not usually the team member that fails. A lot of times it's the team members in the wrong position. And so if you understand what they need to accomplish, what the goals are and what the obstacles are, then getting the right person to accomplish those goals is key in your office. And hopefully we can find someone like a sleep ambassador who can do most of these things.
Well put. To use the basketball analogy, Guy, since we're in the NBA playoffs, that'd be like having your 7-foot center, be the point guard.
Right.
He's a great basketball player, but if he had to bring the ball up the court every time, they stole it from him, although there are some 7-footers who can handle the ball pretty well now. But
yeah, it's amazing. It really is, not to get on that subject. But and
it's what we do, isn't it? I mean, this is what we do. We help that guy learn how to dribble the ball and do all this kind of stuff through, the 4 pillars: the screening, testing, treating, and billing. We try to get what's out of our heads into your heads and how we do this. So we've been doing it a long time, and we do that through education, coaching, software, and support. So we have a complete member support expert team. So I always say, Guy, you have 1,000 questions when you learn how to do this. Remember when you and I started it, I didn't have anybody to call.
Right.
We just, now we're that person that you can call, and we can help you figure out how to do that. So if you're interested in doing that, no cost, no obligation, just type in consult, and one of our member support experts will reach out and talk to you about doing that.
And I'll mention one other thing as far as our services go. I just hired a new team member to begin Monday. And as you grow, you hire more team members. We actually help train and retrain team members too, as people come and go, and as you expand. It takes a lot of time to teach them these dental sleep systems. We actually burden a lot of that for you as an ongoing service. So they go through our system, our training program, and we help educate them so that they can do all the things that we just talked about. And we can educate your whole team, or we can educate just a sleep ambassador. That's what we do every day at DS3. So you need someone in your office, or someone's administrative, clinical duties that we reviewed, and again, you can do that with one or multiple people. And I think one of probably the biggest challenges really for dental offices this is not an island unto yourself. Right. You cannot do this with just the people in your office. And so as we were putting this together, I was talking to Rich about it. I'm like, it's the team is not just within our walls. We have to find ways to do billing. You can maybe do that in your own office, so we'll talk about that in a minute, but it's very difficult. You have to work with physicians. You have to get sleep testing. You have to have labs that are knowledgeable on this. So the actual testing part of this has become so much better than where we were even a dozen years ago in dental sleep. It used to be when Rich and I first met, and I wanted to get one of my patients tested either as a baseline diagnostic test or to see if the device was working that we made them. What do? We sent them down the road to sleep lab, right? You had to send them to sleep lab. The patient didn't want to go. It cost a lot of money. We had to really twist their arm. Once sometimes they went into the sleep lab abyss, and we never saw them again. And it was difficult. Now, ambulatory tests are standard of care. Insurance companies pay for them. As a matter of fact, they often don't even pay for the in-lab test anymore. This is not a optimal service. It's becoming the norm. And having a way to get your patients tested as part of your team is crucial. And so
we could only talk about this for 4 hours, Guy. But again, this is just part of what we're doing. We're trying to help you get your arms wrapped around this whole thing. So there was a question, Guy, I want to address real quickly about, as a dentist, some of the state boards in the states now are saying, hey, we have to have the physician order the sleep test. And that's true. But again, think back a few slides ago that Guy had. Think what the slide before, Guy, I think you just said, you are not an island unto yourself. You cannot do this by yourself. that's where we have to communicate with these physicians. We have to, you know, as a dentist, I've been saying this, how long I've been saying, guy, pick up the phone and call the guy.
Right.
I've been saying that for 15 years. And dentists don't want to do that, but sometimes you just have to pick up the phone. You have to write letters. You know, what you don't understand is you might know as much about sleep apnea as that guy does. You know.
Well, you probably might know more if you go through our training protocols. But I want to correct you on one thing you said. So there are some states that say dentists that can't order sleep tests. There's only 2 of them that I know of, and we'll talk about those other 2 options in a moment. Where for those states that don't say that. But assuming you want to work with a physician, you said you've got to call them. No, that's not true. Your sleep ambassador, your
Right.
team members. That's why you delegate this, because are you going to find the time between a crown prep, root canal, and a hygiene check to call the physician who's not available, and then they call you back? It doesn't have to be you, but yes, I will rephrase what Rich said, in that we have to communicate with physicians at time. But yet, that's the one of your team members' responsibilities. They know when they come to work that they have to do that, and as a matter of fact, they'll start enjoying doing that. Once they become comfortable owning that responsibility.
Now you've got a relationship. You know, now Cindy, she knows that Dr. Smith, she always talks to Rebecca over there at Dr. Smith's, and Rebecca
Right.
knows exactly what to do and what we need to do. So, you know, we want the path of least resistance, both for us and our patients.
Yeah,
And if you can just click a button and order a sleep test, there's nothing wrong with that. I mean, we're all for that. We just got to play by the rules sometimes.
Yeah, so to be clear, we could, like Rich said, speak 4 hours on this. Dentists cannot make diagnosis. They can certainly refer patients to physicians who can dispense or order home sleep tests. And depending on what your state dental board's position is, most state dental boards haven't said you can or can't, and some of them have made decisions, but most of them haven't. Should you be able to say the patient's at risk and order a sleep test that is given to the patient, and a board certified sleep physician reads that information and they make the diagnosis? In most states, that's still possible. You can do that by buying your own piece of equipment and sending that data to a physician that you or the sleep testing company arranges. Or you can work with one of the companies out there. We have 2 that we work with all the time, Blackstone, sleeptest.com, and you can actually, through DS3, at a click of a button, order a sleep test that is read and interpreted and diagnosed by a board certified sleep physician. And basically, these sleep testing companies take care of everything else. They bill the patient, they ship the units to them. So again, that's a whole nother webinar on itself. But if you're going to be successful, you have to have a way to test the patients, and it's going to require some team member involvement or some system outside of your office. And if you don't have that in place, it's not gonna work. So treating, I think, is another thing we have to involve. Rich, I think you've got great relationships with airway management. I think you and Keith over there in Texas have worked together for many years. We have a lot of other labs we work with. I can tell you this: when I first started doing this, Rich has been doing this longer than me. I've been doing almost as long, but he was doing a lot more volume than me, and he gave me a lot of advice as I was trying to incorporate this into my dental practice over 15 years ago. And where, you know, Rich was too busy to come to the phone, I would send a case to the lab, and the labs that I could get a hold of someone on the phone who was like, oh yeah, here's this, and let me tell you, you're missing some molars on the lower right, so an EMA is not really a good device because of where it attaches, and I'd consider a dorsal design here. You want to work with a lab that's done this before, that this is not just a one-off for them, that they communicate well, that they have someone there you can talk to who understands dental sleep, that it stays on time, and all the things that you want from a lab. But it's important to vet your labs. We have a lot of them we work with: Dynaflex, MDX, Airway Management, Whole U Respire. These are labs that
they get it. They get it.
They get it.
They can give you a lot of those tips, just like you said. You know, I think most dentists could pick up a cast and there's no molars on the lower and go, hey, an EMA probably wouldn't work well here. But you'd be surprised at how many times we do that. Mm-hmm. And so you want to work with a lab that gets it. I like the digital workflow, Guy. I'm glad you put that on there, because we're taking scans now. We have been for a few years. We're taking digital bites, so we don't actually mail anything anymore. You know, we're actually
right.
just doing that. So the ability of a lab to do that and do that kind of thing, if you're into that and you're doing that, really does make a difference. So I think you hit some high points there, Guy, that are good.
And billing, we're not spend a whole lot on this tonight because we're got a whole webinar on it in a couple of weeks. But I just want to emphasize, if you're going to bill medical insurance, insurance rather, for dental sleep medicine, it is a medical billing, and it's totally different than dentistry. Here you're comfortable with all these things in dentistry, whether it's root canals, well, maybe rubber dam would be a good idea there. But other than that, you're probably comfortable with all these photos. I don't know how comfortable you'd be flying the plane when the pilot says, or the flight attendant says the pilot has had a heart attack. Can anybody fly this plane? Or, hey, today's tax day. Let's say you get audited. Yeah. Do you file your own tax return and you'll feel really good when the tax auditor comes to you, or if you get sued, are you going to be comfortable doing your own defending yourself? Well, I can tell you, if you haven't done medical billing, if you don't have a medical billing expert within your internal team, I'm not talking about dental billing. If they've never dealt with medical billing, because it's entirely different, it's different as root canals and flying planes, then you need to hire a third party to do that. And we have great third parties we can recommend and work with you. The way it works in our offices are, we have about a half dozen, more than that, third party billers that we work with that you can seamlessly order, or not order, but
bill for your dental devices.
Bill for the dental devices, and they give pre-authorizations and so forth. But prior to us even involving them, we also have the ability, with a click of a button, to know what the patient's benefits are. So the way the workflow in our office is, it comes in, patient for a consultation, we do what we call an instant eligibility check. That's what you're seeing here on the upper right. We look at their benefits, we get an estimation of what their out-of-pocket will be, and we can provide that to them, and we'll teach you how to do this in the next webinar at the consultation appointment. We give them what we call a maximum out-of-pocket, or a MOP, from that instant eligibility check. If the patient goes for treatment, we click a button, and it sends that data to the medical insurance billing company, which takes care of it from there. They send the claim off, they follow the claim, they make sure you get paid. They take a very small fee compared to what the services that they're providing. So there's a lot of companies out there. I can name just a few: 4-Pillar Billing, Pristine, GoGo Billing. There's other ones we work with. All I would ask, if you're going to do this, don't do it yourself, and do your homework. Check for references, call other clients, look at their fees, see how they communicate. Is it, you got to send them a pile of paper? Can you do it with the click of a button? And just check out their reputation. Some of them do great, some of them that don't do so great. And then I don't want you to get the say, well, the DS3 team said get a third-party biller, and that made things more complicated. If you use the right ones, it's going to take that.
It's going to make your life better.
Going to take that from this big a problem to something very manageable. And this, I think, Rich, you just hammered on this a while ago. We can't do this without, no matter how much we do the home sleep testing and work with medical billing and train our sleep ambassador. I just don't see it's possible to provide dental sleep devices for our patients in a ethical, positive, above board manner without involving the patient's other medical healthcare providers.
Yeah, and it's not always a physician, Guy. I'm just amazed every single day how many people I say, well, who's your primary care physician? Well, it's, Guy Yatros, but I always see Rebecca, the PA. I haven't seen Dr. Yatros in 5 years. It's amazing how much PAs do and nurse practitioners do now. So what we found in my office, Guy, is our sleep ambassador, our person who's doing that, communicating with that particular medical office, that person creates a relationship with somebody in that office. And it's almost like I'm the doctor here, and that guy's that lady is the doctor over there. But we communicate through our staff doing these types of things. So again, like you said, Guy, it's not me, the doctor, that always has to do this, but we do have to communicate. We've got to track down sleep studies. We've got to get prescriptions, letter of medical necessity. We've got to do a lot of these things. And I will say, as an end to this slide, Guy, that that's probably one of the single best ways to develop a referral source. It's like, man, this guy Drake, he really does things right. He always calls me. We work on the sleep study. I get the prescription to him. He sends me letters back, about all this kind of stuff. So, that letter writing is such a great way to do this. But the bottom line is we got to communicate. We have to do that.
And we're doing this to do it properly. And but the previous slide just emphasizing what Rich just said. If we do it properly, and again, we meaning our team, not necessarily Dr. Yatros or Dr. Drake doing this, we communicate well, we will develop referral sources out. They'll see we get it and it'll come back to us. So how do we do this? You have to write letters. You have to write letters to all their physicians. And I think I'll put it in a dental term scenario for everybody, Rich. If I did this actually last weekend at the course, I asked one guy, I said, how would you feel if you had a patient that was missing some molars and he, didn't consult with you, saw some ad on TV or something, went to a periodontist and he came in for his 3-month hygiene check and he had 3 implants in there? How would you feel? You know what the true story, what the guy said? He goes, well, I'd be upset because I'm a periodontist. I didn't realize he was a periodontist, but in general, you would be upset if your patient came back. I said, well, would you ever do that? He said, no. And the reason he wouldn't do that is you would be upset if your patient went and some periodontist just put in some implants without saying, hey, what kind of crowns you're going to put on here? That's your patient and they need to communicate with you. So we're not trying to do this without the involvement of the other health caregivers. We're doing a medical procedure. We're helping them with what's called durable medical equipment, and they need to know what we're doing so that they can help better manage the patient's overall care. We're not their doctors. We're just doing one piece of this, and they need to know we're doing this because they may need to adjust medications. There's all kinds of things that they need to be looking at. So every time we see these patients, any physician they have, we're going to communicate with them, and our team members need to find a way to do this. You can do this through dental sleep software like we have. You don't just do it the day they walk in and say, okay, we saw them. We've got to communicate along the way. I'll refer back to my periodontist that I worked with over the years. The reason I worked with Dr. Eastman, a good friend of mine, he became mainly because of his good communication. I would work with him. He'd send letters back. I never lost the patient. Some of these treatments took 2 years with him. If he just sent one letter at the beginning, I'd wonder what the heck was going on with the rest of it. Well, fortunately, dental sleep typically doesn't take 2 years, but we can take 2 months. And these other medical professionals need to know where we are through our communication.
And I don't think we can stress that enough, Guy. We might have a feeling for that as a dentist if we are a specialist. Mm-hmm. We would appreciate that more. But dentists don't write letters. But we have to understand that that's how physicians communicate. And again, we've crossed that line from dentistry into medicine. We have a dental solution for a medical diagnosis and problem. So we just can't stress that enough. I know a guy in my office, I clicked on a button before I left this afternoon. January 1st to today, how many letters? So we've got several reports in DS3. I've sent out 1,990 letters.
Wow.
January 1st. That's how many letters have gone out of my office. So we don't want to overdo it. We don't overkill it. But remember, that doctor wants to know. And if you do it and you do it well, I promise you will get a referring doctor out of that. They will just go, man, I don't have to wonder when I send them to Drake. I don't have to wonder if he saw them. I don't have to wonder if they're being treated. I don't have to wonder where they are in treatment. I don't have to wonder if I need to step in and maybe we need to add CPAP to this regimen or something like that. And that's how easy it is in DS3, Guy. I just click a couple of buttons. I have all these templates that we have in there. It pulls from other fields. It writes, I'm going to say 95% of the letter for me. I just have to go in through a kind of a word processing thing and change a few words around and then click send. So through our digital HIPAA compliant fax, then that winds up on their fax service.
Yeah, and that's the way they prefer to have those. But to bring this back to the subject, because somebody may be sitting thinking, wait, this is supposed to be about team involvement. This is about team involvement. You have to have a team member who is responsible for doing this. And again, a lot of this happens back in the chair where we saw the patient. Yes, DS3 does a fantastic job of templating a letter, but what if that patient had something strange? They had a nodule on their tonsil that you were concerned about or something. Well, we don't have a template for that. It needs to be put into one of these letters. So the sleep ambassador, the assistant, whatever team member that is in that room needs to know to put that into progress notes and also copy it over into the letter. And then they need to communicate that to your other team member, which is the physician. And then we need to make sure they receive that communication. And together as a team, we learn, we meet and decide on what the next course of treatment is for that particular patient. So it is all about team. You can't manage this information or your team or your patients without some sort of system for doing that. It's just a lot of information here that has to be managed, from screening to testing to symptoms. And you've got to have a system for doing that, and you have to have team members who are responsible. So to kind of review where we were with this, you have your administrative and your clinical team. You as the leader of, you meaning the dentist, I think you need to help drive the ship and decide on what the systems you're going to use, the external team you're going to work with, how that's going to go, and then all these tasks that we've talked about. I guess we could have called this webinar assigning tasks or something, but that's, I mean, every office is going to be different. One may have one person that does most of this. That's what we know works well. Other offices do okay, but you have to know each of these individual tasks that have to be done. Someone has to be proficient at doing them. They have to own it to where we know if it's not done correctly, that we can say, you know, John, Jane, what's going on here? Let's help you understand better how to do this. They have to become proficient at doing it. So how many team members that takes depends on how you like to make this particular recipe work, I guess would be a way of putting it.
Right. And how much volume you want to do and what you do. So, Guy, listening to you, I'm getting a little bit overwhelmed, you know, and I just want to, I want to tell everybody out there who's thinking about doing this that, remember, we've covered everybody from the beginning of treatment to the end. There are a lot of steps in between there. So we do a lot of education. We do a lot of webinars. You've heard us several times say, well, this is really a 1-hour topic, you know, and we talk about the sleep testing than that. We really just want you to get an idea of how much of this you can delegate to your team and different members. And if all of them work, you know, the moving parts are working together, it's really not that complicated. We break it down into little pieces. So I guess I'm trying to say, Guy, I don't want people to be overwhelmed, you know, with the amount of things that you're talking about, because I get a little bit of that feeling.
Yeah, and I understand there are a lot of pieces. None of them are complicated, but that's what we do at DS3 is we put those together. And I do believe if you don't have the proper system, you get overwhelmed. Kind of like this picture right here.
Yeah.
I mean, it's, you know, that's just an organizational problem right there. Are those pages anything that's, you know, I don't know what's on those pages, but they're not complicated probably. But it's just, that's an organizational problem. And the problem is that the dental softwares do a great job for dentistry. They do a great job of managing the composites, root canals, dental appointments, dental data, so to speak, when they don't do a great job for dental sleep. Furthermore, many of them are not an electronic medical record, which if you're doing dental medical billing for dental devices is becoming the norm and something that is needed and to properly file medical claims. And so DS3 is a certified, it is an EMR that you can access from the cloud. You don't have to worry about losing your data, as Rich's office burnt down. God, it's been a long time ago now, but what, 8 years ago, something like that?
It can happen. You can walk out your door, and yeah, if you're backing it up, you better be backing it up to the cloud. So I didn't lose any data, you know, when we did that.
Yeah. So again, with Rich saying you don't need to get overwhelmed. You just need to have a plan. You start with the why. You get your vision. You get the team again on board. We don't just say, team, do this. Hopefully they have their own whys, and we agree on the why together. And then you need systems for each of this. It's not, I mean, what's difficult is finding that auxiliary canal on a lower second molar. That's difficult. This is just setting up systems and protocols for patient flow and patient information. So you determine the various outsourcing team members that we need, from HSTs to lab, start screening your patients, and you'll be well underway. And that's what we do. If this does seem like you want more information on how to do this, you type in consult, and we can sit down and break this down into more and more pieces for you. I think the payoff's worth it, though, Rich. I have to tell you, at times I was stressed when I first met you. I knew this was valuable. I knew this was something I wanted to do. I'd had enough success with the limited patients that I'd actually given a device to, and saw how it changed their lives and how it made them feel and how it made my team feel for providing the service. So that's the end. That's not the that's what you'll get. That's the why, and it'll reinforce that. I think it's worth putting those pieces together for.
Absolutely. We talk about it being the most meaningful work we ever do, Guy. I mean, as a dentist, I love to get somebody out of pain. They came in, you open a tooth up and pus drains out, and you think, man, I'm going to save that tooth and all this other stuff. And I felt good about that, and I think you should feel good about that. There's nothing wrong with that. That's what we were trained to do. I think this is just getting a little bit out of most dentists' comfort zones, Guy, because, I mean, think about back in dental school, if they'd give you that, Jimmy John, whatever you call that mannequin there, you're going to work on him. And there was a big stack of books over there, and they said, hey, well, we'll be back in 4 years, and you just got to pass a couple of tests, and good luck. I mean, right. That's crazy, isn't it? And that's kind of what we're talking about here. You got to have, you got to start the process. There's some education. It's all very doable. I promise you, if you can learn how to do a root canal, you can certainly learn how to do dental sleep medicine.
Yeah, so we don't just, you mean you didn't just show up to dental school and they just didn't, here's a pile of books and here's a typhonont and go to it?
I didn't even show up half the time, Guy. I was already
I think that's why we're such good friends. I think you and I are cut out of the same mold from that. But we did make it, and but they did have a curriculum and a plan, and you do these steps, and the payoff was, hey, they even gave Rich and I dental degrees at the end of the whole thing. So, anything's possible. If we can do that, you all can do this, I promise you. But it does require steps, and it's a whole lot easier than dental school, I can promise you that too, but in a whole lot less time if you have the path laid out for you. You need a system for doing this. It's not just, I'm going to hand this person this piece of acrylic, and they're going to love me for the rest of life, and the husband's going to, or wife's going to say, thank gosh she quit snoring. I mean, that's part of it. But you won't continue to be providing that care for long without making some of these critical decisions, checklists, and figuring out ways to do that. And I know that we do a lot of these webinars, and certainly we hope to give some valuable information to where you can go back and use this. I think it was great information. I know it's kind of a lot of it out there. And I know that we also want to promote what we do. But I can sincerely tell you, we promote what we do because we believe in what we do, and where we get our satisfaction is seeing dental offices succeed at dental sleep. We hear the success stories from them, from their patients. We just had that symposium we'll mention in a little bit, where we had hundreds of our DS3 members there, and if I heard one, I heard 36 stories about how dental sleep has changed the lives of the team members in the office, the dentists themselves, and the patients. And of course, we got a lot of thanks for the help. So don't try to recreate the wheel. We will help you with all that stuff that we threw out there today to help you. And that's what DS3 does. For just around $1,000 for 3 months, you can go through the training to where you and your team can be delivering devices by the end of that 3 months. You can be well educated if you'll follow the system. There's no one else in the country that can teach you what we do. So if you're interested in learning more, just type in consultation, or Jody, give me a call, something like that, or Brandy. And even if you not so interested in hearing about that, but you just have a challenge on any of these steps of dental sleep about how I can perform these in my office, or our team can perform each of these steps and get the patients well treated with under an hour of dentist time, type of consultation, and we'll find out what your challenges are. You know, we put this up in some of our webinars, Rich, and I think we started with the why, and this may be some people's why. It wasn't my why. It was part of it. It became,
doesn't hurt though, does it?
Doesn't hurt. I mean, so your why is not one thing necessarily. There's nothing wrong with making money. One of my new team members today, we had some discussions, and that's what he said. You know, there's nothing wrong with making money. And I thought, well, I like the way you think. That's good. That's positive. We make money. I can pay him. He can do nice things with his family, and we can all continue to come to work every day. And there's certainly nothing wrong with making money. There's nothing wrong with saving people's lives and making their daily lives better. Dental sleep does both. And I can say this, if money is a motivator and it's something you want to look at, there's nothing you can do. Nothing. There's no Invisalign, implants, root canals. There's nothing you can add to your offices that is more financially lucrative, has I'm saying it wrong, but
has the upside that this
has the upside that this does. Dental sleep, it's the sky's the limit. 1 in 5 adults has apnea, and you know, Rich, that's all you and I do. I don't know too many people that just quit their dental practice because they're so busy in Invisalign or something, one of these other procedures. If you do even just one of these a week and take 4 weeks off, it can add, you know, push just south of six figures to your and we're not making up. These are all very conservative, $2,500 a device and $350 lab fee, and even including paying third-party biller, even including our fees and all that. So it's very conservative figures if you want to look on the upside. If you want to do this and have a plan, that's what we do. We'll give you something else for free while we're here. I think we've got to get another issue together here next month. One just came out. I got the email from Jason this week that I got to get my article together.
Don't remind me.
Every other month we put out a free, I'll emphasize free publication, Dental Sleep Insider. So if you're not signed up for that, go to this website. I told you we just brought on a new team member. He's been involved in sleep for quite some time, but not dental sleep. So one of the tasks I said, just go to Dental Sleep Insider, just start reading all those back issues as part of your training. Because there's great articles that are real practical on how you do things in dental sleep, videos, everything from billing to managing slipping discs, to how you add more acrylic to a dorsal design when you run out of advancement in these articles. So
all kinds of good stuff in there, Guy. I think we've done what, 25, 26?
Yeah, they're lining the halls of the DS3 corporate office, and we're going to have to go around the corner here shortly. We've done quite a few of them, and I'm really proud of those. Those are well done, and they're good content that we get a lot of positive feedback. The other thing we get a lot of positive feedback is from our courses. We just had one in Tampa this weekend. We do one of the best, if not, I will say the best, hands-on dental sleep course. So if you want to learn how to do this and spend a couple of days with us, we actually, you or one of your team members get a dental device made by one of our labs. You get to wear it, we'll fit it at the course. You actually get to take home a home sleep testing piece of equipment, so you can feel how that feels. You can see how they work, understand how you read the data, and you can actually see what the data says for your particular case. If you think you may have some airway problems, we make repositioners for bite. We spend a lot of time on medical billing, and it's only $999 for you and a team member. And if you want to come to one of the ones coming up, there's other ones that we'll be adding. Type in course and you'll get $200 off. So I mean, that's I know Rich cringes when I say that.
I can't hardly hear that, Guy.
Because it's such an incredible,
already such a good deal.
Rich or myself will teach most of these, and I can promise you that you'll leave there. We don't ever have anybody come in and saying, "Wow, I wish I'd have done something else on my weekend." You'll be happy that you spent a day and a half a day, a little over half a day on Saturday with us. So there's that, and the symposium, Rich, man, it's we're getting some good people signed up. This is incredible, huh?
Yeah, we did that in 2017 and 18. It's in February on the beach in Florida. It's a good reason to go next year, guys, especially if you're live in the north where it's still snowing. It was 94 degrees here in San Antonio today, but a lot of good practical things. I think what I want to say about that guy is it's hands-on kind of stuff. It's how do you do this? How do you do that? I know you talked earlier, in February about how to create that relationship with the physician. You gave people a lot of really, really good information on that, and we got an all-star lineup of speakers there. So I think you guys will definitely get something out of that. And
we will sell out. This is the third year we're doing it. The facility only holds so many. We had just south of 400, I think, or around 400 people there, which is almost double from the previous year. So if you want to come, go ahead and sign up. I'm confident the rooms will sell out too. We got a fantastic rack rate for the rooms. I think they're $250-ish, which is a great price for a room in February on Clearwater Beach Hilton. So let us know if you're wanting to come to that. Also, one more time, 2 weeks from today, we will go into detail about dental sleep building on May 1st, at the same time at 8 o'clock. And I think that gets us down to our information slide. I know Rich, the team, and you have been answering a lot of these questions. Look at us, we're finished technically on time here, but let's see what other questions we have. Is there anything else that anybody's typing in there?
The only other one, Guy, I want to do that we didn't have time to do was this whole in-network thing. I just want to touch on that. So we'll certainly spend more time on that next time. But if you're a dentist and you want to make a device for a patient who has Aetna insurance, and Aetna won't give you a gap exception because there's a dentist in your area who's in network, well, now it's time for you to get in network.
Mm-hmm.
I wouldn't suggest that you do that until that point, because a lot of these payers are still giving gap exceptions and doing that. And if these words don't mean much to you, you'll have to tune in a couple of weeks where we'll do that. But there's a process of contacting the provider relations for that insurance company. And then there's a simple application and a process that you go through, and then you spend some time negotiating a reasonable fee. So, of course, the trade-off is if you do all of this, then I know exactly what the patient is responsible for. Sometimes we have to guess a little bit because we don't know the allowable or something like that. So, Guy, I think
I see one more question there. I'll answer it while you're
got the full time.
Yeah, so my answer, what about the sleep ambassador? Should I hire him full-time or part-time? I will tell you, my vote would be for you to hire him full-time, him or her full-time. That being said, originally I had our first offices that we started doing this with a few years ago. Oh, they were hesitant. I said, you know what, just run a Craigslist ad. Doesn't have to be a dentist, a dental team member, car wash, the things we already mentioned. Hire them part-time and tell them, look, this is a career. You're at this dollar amount to start with. When you get productive, you're going to move up. We're going to set how much you should be making at whatever period down the road. And when you're busy enough to be full-time, when you're bringing in this amount of revenue, you can be full-time and you get a raise. And almost every office has done that within 3 months. That person's been full-time. So if you're hesitant, do that. If you're worried about the cash flow. But I can tell you, if they're not full-time in 3 months, either you've not done your job of properly educating them on what they need to do, or they're not doing their job and you need to find someone else. You've hired the wrong person. 1 in 5 adults, or you live in a pediatric-only community or something, but because 1 in 5 adults has this problem. And if they can't be busy full-time in 3-4 months, then they've not done their job. So it just depends on how much risk you want to take. There's really no risk if you do it correctly, especially if you utilize us to help you. So I hope that answers.
But again, a lot of this is that team thing, Guy. It's if you walk into an office, one of our DS3 members who's been doing this for a while, and they have that person. You walk into the hygiene room and there's posters up on the wall about, do you snore? Drowsy driving. Every time a patient turns around, everything is kind of, it's this whole entire theme of everybody working together to try to get people into that funnel where we get them sleep tested, and then we can make them sleep devices and get paid. So it's all that the team cannot be emphasized enough. And I think you did a really good job of that tonight, Guy, pulling together that team and kind of giving all of us a really good idea about all of the different things that have to be done, and all of the different things that we got to get our arms around to really make this work well.
Yeah, fantastic.
How about incentives, Guy?
Yeah, so Steve Carstensen, who talks with me at the Pank Institute in a couple of weeks, he offered that, said, look, we're going to put some money in this kitty, and when we have enough, I'm taking everybody. I forgot where he said he was going to take them, Hawaii or someplace like that. And he thought it would take him 2 years, and about, I think, less than a year. I'll have to ask him the story again when I see him in a few weeks. They had enough money. He took the whole team somewhere on a cruise, something. I forgot exactly what it was. So absolutely, if you can come up with a creative way of doing that for the team or the sleep ambassador, again, if you want to say, look, you're new to this, I'm going to be teaching you how to do this. DS3 is going to be teaching you. When you get to a certain point, here's your goals. And I think one thing I've learned through many years of working with team members and been fortunate enough to hire people like Jason with us to help for a better system, you need to have goals for your team members. You hire a new team member, here's our goal. Let them know what you're hoping, what you expect, and when they hit those goals, you reward them. And a lot of times you can say it, set those goals ahead of time, and people like goals. So absolutely, great idea. Share the wealth, share the joy, and it's not just about money for people. It's that they want to accomplish something too. It's about winning and helping patients and feeling worthwhile. So absolutely, great idea there.
Yeah, we got all kinds of ideas with stuff like that. That's part of what we do when you engage us as Dental Sleep Solutions. So we get your team involved in the training. We go through different training processes, and you have a little bit of homework to do and stuff like that. And like Guy said earlier, we're getting dentists, they're not only 3 months later, they're making devices, but they're actually getting paid. That's what really makes them turn the corner, doesn't it, Guy?
Yeah.
They feel so good about what they're doing, and patients come in and, oh man, this thing's working great. I can't believe it. I'm doing great. And then you actually get paid for all that. It's pretty exciting.
Well, that's one of the reasons that we began offering about a year ago our 3-month package there where it's a little over $1,000. If you'll follow what we call the DS3 experience, which is a step-by-step process to engaging you and your team and educating you and your team on utilizing the systems to provide dental sleep, along with getting credentialed for billing and so forth. By the end of that 3 to 4 months that you utilize that introductory offer, most offices, if they do follow the system, are getting paid. So they've already paid for the amount that they paid us. They've started providing this valuable service, and most people love it and decide this is fantastic. We're going to keep going, and they're having a good time, and the team's all on board. If for some reason it's not, then at the end of that 3 months, then at least they know that they've gained all this knowledge, and by now they at least identify patients who need this and are prepared to refer them to people who can see the patients in other DS3 offices. So I'm excited that we had a lot of people on here tonight. I'm confident that dental sleep billing will, sign up for that if you're going to make it.
Yeah, that's always our busiest one, Guy, when we talk about billing and that. So apparently, I think the flip side of that, Guy, is getting paid is important.
Yeah.
It may not be our only why, but it's, we have to make a living and we have to be successful. The more successful we are, the more people we can help. That's the way I always look at it.
Yeah, and our team too. Sometimes it's the team needs to understand that if we're not successful, they can't join in this. They can't take their kids to soccer games and some of the things that they need to do. And nothing wrong with being successful while we're helping patients live better, live longer. So I think that's about God.
Thank you, Guy, and Jason's on there too. Thank you guys for putting together a beautiful PowerPoint there, and thank you guys for joining us. Those of you who have not yet got your check in the postmarked, you better get it done to the IRS.
Yeah. I think you've got, by at least here, you got about 2 or 3 hours to make it to the post office tonight. Thank you for joining us on this evening. We hope you'll be on next time. If you need any help, don't hesitate to contact us for patient questions, billing questions, implementation questions, or to come to one of our courses in the future. Just contact us at info@dentalsleepsolutions.com. I think that's good enough, Rich. I'm going to end it unless you have anything else more profound to say than you already have.
Goodbye.
Good night.